So today we're talking about bulging discs and core strengthening. And I'm a concierge physical therapist. When I work with my patients who have bulging discs and we want to improve their core strength, it starts with knowing more before we can do more. So we get a high level education followed by very specific and very effective core strengthening exercises that are safe for disc bulges. So if you want to know my 3 favorite exercises that I know are not going to hurt you, not going to cause you more discomfort, but are some good ways to improve your core strength with a disc bulge, hang with me. We're going to go over those things right after we do a little bit of education about disc bulges, some myths, and some things that you want to know. Okay, so we're talking about disc bulges and core strengthening. And so when I work with my clients and my patients who want to improve their core strength and they have disc bulges, the first thing we do is talk about education. We want to talk about the myths and the facts related around disc bulges and core strengthening. So let's start with core strengthening. 1, your core is much more than your 6-pack abs. Your core is your glutes, your lower back muscles, your hips in general. Yes, it is the front, but it's also the sides, it's the back, it's the top. It's basically from your neck to your pelvis. Like that is your core. And remember, if we want to improve our overall resiliency of our spine and our disc bulges and other things that are going on, we want to think of the core as a whole. We want to work the body as a whole because when we are doing the things in our life, it's going to require for everything to work together as a whole. So let's start there. We need to work more than just our 6-pack abs. After we understand that, we work right into the education with disc bulges. So I can sit up here and show you the model and that little red thing pressing into the spinal cord and the disc bulge, but essentially is that the disc is comprised of the annulus fibrosus and the gelatinous material in the middle. It's mostly water, and what happens with a disc bulge is that material in the middle starts to push into the annulus a little bit, causing it to stretch most likely in the back and off to the side. Now, with that being said, if we do MRIs of people in their 30s and above, 50% of people will have disc bulges in their spine with or without discomfort. Basically what I'm saying there is that if you're approaching the 3rd decade of your life and beyond, most likely if we do an MRI of your back, you're going to have multi-levels of disc bulges. And that's just the way it is. It's just like wrinkles on your skin. It just happens over time. I'm not saying you're not in discomfort, but what I'm saying is that the disc bulge related to your pain, it's loosely correlated in that there's lots of people who have the disc bulges without pain, and there's some people who have disc bulges and have pain. And so what I'm saying is that we need to learn your body a little bit. And so when I'm working with my clients, yes, there are a fair amount of disc bulges that we see on the MRI, or maybe even disc degeneration or just disc changes in general, but we kind of lump that into arthritis or just degenerative changes. And so all I'm saying is that it's very common and that you can easily have relief without having a change in your disc bulge. And so don't get hung up on the disc bulge. It's just something a part of your body. They're going to ebb and flow. They're going to be there whether you have pain or not. And so let's just focus on improving your strength and resiliency. We know that people often have disc bulges, but we could still improve their core strength. What I also want you to know is that when we are working, or when I'm working with people who have disc bulges, right, we're approaching the whole core as well, but I'm also, these patients are also presenting with symptoms that are most likely related to like radiating lower back discomfort that can be in the middle or off to the side a little bit, typically not all the way down the leg. And it's just like a stiff, achy presentation, and that they're like, hey, like some ranges of motion don't feel great. I'm kind of having some glute radiating discomfort, or maybe just central midline, just meaning in your lower back discomfort. And it's just kind of there. It feels better with movement, it feels worse in the morning. Some certain positions are uncomfortable. And so those are the types of things that I'm taking in and I kind of thinking about before we move into the core strengthening, in that we want to make sure you're appropriate and that disc is made to do many, many things. And so when I'm looking at you, okay, we know disc bulges are common, may or may not be causing the symptoms, but it really doesn't matter. What are you feeling? Oh, you're feeling X, Y, Z, and where's the best place to start? So today with my core strengthening, I'm going to work your disc and your back in the areas and in the ways that it's made to do. We're going to do a little compression, a little bit of rotation. You're going to see a lot of videos out there, people just on their hands and knees or laying on the floor and doing these gentle exercises. But your life requires much more than gentle. So I want to work you up. So I want to go over the 3 exercises that I love to do that's a little bit of a progression. And just remember, when I treat clients in the clinic or in here or I'm at their house, I'm working them in a stepwise progression, and that we start here, we do this next, and then we do that after that. So just remember, this is just a little snapshot of that one moment, and everybody's body is different, but I wanna go over 3 of my very favorite things to do that I'm working your disc into all of its natural capabilities, and we wanna listen to our body along the way. So I'm gonna be doing them on my table and one standing. Just make sure you clear some space around you. With our standing exercise, you're gonna need a chair. You can get a yoga mat, lay on the floor. I'm going to use my table just because it's easier for you to see me, but I'm going to go through exactly what it should feel like, how you should do it, and the reps and sets are going to be in the description of the video. And so just use this video as a reference, pause when you need to, listen to my cues, because I'm going to structure it in a way that you are having some stiff achiness, discomfort, maybe some radiating back stuff into the hip or to the side of the glute, and we're going to go from there. So let's get ready to have some fun. We know that disc bulges can get better, you can feel better. We've done our education, now we're ready to start moving. Motion is lotion, let's start feeling better. Okay, so when I work with my clients with disc bulges, we're talking about core strengthening. We want to mobilize, then strengthen. So you're going to see that today. Let's get on our hands and knees first. So you're gonna see me get on my hands and knees. This is called the quadruped position. Remember, I just got done talking about how most people do exercises in this position, but I wanna focus on mobility. And so the reason why I like getting on your hands and knees is because gravity's pushing down on you, so we could use that to our advantage. So the disc in the spine is totally responsible and safe for it to do flexion and extension. So we're gonna do what I like to call like a modified press with a prayer stretch. And so this works into flexion. We're gonna sit our butt down towards our heels, and then we're gonna bring our hips to the table, work into extension. Now, when I work with my clients who have disc bulges, who are having that stiffness and achiness into their back and hips, what I tell them to do is go into their discomfort, but not past it. So a little bit of flirting with the pain. So hips to the ground, I feel stiffness right there, then I come up, and then I sit butt down towards the heels. Okay, feel the stiffness there, working into extension, and then butt down towards the heels, okay? So we're gonna go flexion and extension, working into it. We're gonna do about 12 reps here, mobilize, then strengthen, so you know what's next. The strengthening, hips down, feel the pinch, and then come back. Feel the pinch, and then come back. Oh, okay, this is the prayer to the modified press. We got 2 more here. Mobilizing. Then we're gonna keep going here. Okay, now I've had my patients in their 50s, 60s, 70s, and 80s do this. If they have a little bit of knee pain, you just limit your range of motion. Now in the quadruped, we're gonna hit rotation now, right? We gotta hit rotation. So reach through, stabilize with the left arm, and then reach through with your right. Stabilize with the right arm and reach through with the left. Oh, I just had a good pop there. Now we're working into rotation, which is totally safe for the disc bulges and the spine stuff that we all have, including myself. We're gonna reach through. We got 5 on each side here. We're at 4. Okay, we're gonna reach through. Now, what I'm doing in my reaching through is I'm breathing out. And I'm feeling a pull and a rotation in my lower back. Pull and rotate. But what you will notice, and I promise you will notice this, is that you will start to loosen up. You'll get more range, which is awesome. Reach through, come up. Reach through, come on. I think I got 2 more on each side. Reach through, come up. Reach through, and come up. So a little tip, if you're having some knee pain, just put a towel underneath your knee. It is a little bit on the shoulders. If you can't handle the shoulder discomfort, then just modify your range. Don't spend as much time on there. Okay, it's all about learning your body. Remember, this is just a snapshot of what I typically do. This is a good place to start. So we've mobilized into flexion, extension, and rotation. Now we're gonna work into the strengthening. So we're gonna work into the flexion, extension, strengthening using the quadruped position. So stabilize with your hands, kick out a leg. You can open up a little bit or kick straight out. It's okay, things happen. And then tuck underneath. Stay on that one side, tuck underneath. Extend, tuck underneath. We wanna work into that range we just worked so hard to get. Let's improve that, right? So hands and knees, hands underneath the shoulders. Kick out, flex. Kick out, flex. So what I'm doing is I'm using my butt muscle to extend my leg and my core to bring my knee to my chest. Core to bring my knee to my chest. Core to bring knee to chest. Core to bring knee to chest. One more. Core contraction. Remember, your core is your abs, it's your lower back, it's your obliques. We're hitting all of that now. It's so good, okay? Extend out, underneath. extend out, underneath, extend down, underneath. Okay, you get the point. Now, keep going here, stabilize, feel your core work, crunch that core, then use your butt to stick your butt out, or your leg out. Core, butt out, 3 more. Core to butt out, core to butt out, and 1 more, core to butt out. Now, if we're looking to improve the integrity of our back and how it feels in our core strength, the dosage is very important. How much you do to get the change that you're looking for. So, if you're first time doing it, just do 1 round. If you've been doing core strengthening for a bit and you've been feeling good, go ahead and hit that again for another round, okay? Back to back, okay? So it's 10, 10, 10, 10. Mobilize first, just do about 1 set of each of those and then strengthen. And now that we've done quadruped and then the hands and knees, and then we've brought the leg out and then bring it underneath, we've worked into flexion and extension. Now we're gonna do a little bit of rotation, and that we're still gonna be on our hands and knees, but we're gonna help compress that spine with a little bit of rotation, which comes from the similar technique, which is that leg out, but now we're gonna crunch to the other elbow. So now we're getting a little bit of rotation of our lumbar spine. So left leg out, bring it to the right elbow. Left leg out, right elbow. Left leg out, right elbow. Now I'm not focusing on my form quite as much. I would rather you guys be a little bit more successful and just move your hips and back. So left elbow, right knee, left elbow, right knee, bring it back, left elbow, right knee. You can see that little motion right there is that little bit of rotation. Let's switch it up. Right leg out to left elbow. Right leg out to left elbow. There's 2, 3, right leg out to left elbow. Right leg out to left elbow. I'm gonna switch up, right leg out, left elbow. 2 more, elbow, and then last one. Perfect, guys. So 8 reps on each side of those because it's a little bit more advanced. So you've mobilized, you've done your strengthening. If you're familiar, do those 2 strengthening exercises 1 more time each before you move to the standing exercise, which is my big bang for your buck exercise because we want to be efficient and effective. Let's move to standing right now. Okay, I got my bench right here. What you're going to get is a chair behind you, whether a dining room chair or some sort of stable chair. Now, at this point in time, you may be feeling a little loose. Typically, my clients are feeling looser and ready to go, and some of them may be feeling a little bit of their back achiness and stiffness. So just remember, the very first 2 mobilization exercises that we did to help improve range of motion and reduce discomfort, you can do again. That's completely fine. Use those to your advantage. Or you could take time after this and do those again. But enough of me talking, we're gonna get to it here. So we're gonna move into a squat with an overhead reach. And so remember, the spine and the disc are responsible for compression and extension and rotation. And so we wanna work into some of that. So I'm going to rock a little bit forward and then stand up and then reach. You're gonna see me go out of frame there, but that's okay, you know what I'm doing. So we're gonna stand up and reach, stand up and reach. Now, it's okay to rock forward a little bit. That's completely fine. You want to feel strong and you want to feel like you're doing something. At the very top here, you're going to see me squeeze my glute, arch my back, and reach. There's 4, 5, 6. Okay, so stand up and reach, explode up. Now, I know it's simple, and I know some people may need to rock a little bit more, right? And that's okay. If we want to working our entire core, remember our core, lower back, hips, abdominals, way more than we think. So we're hitting it. And then also if we do EMG studies to help guide our exercise progression, this works a lot in a very short period of time. So you're gonna get your heart rate up and improve your core strength at the exact same time. Stand up and reach, stand up and reach. Okay, stand up and reach. I do recommend, as our capstone exercise, we're gonna stand up and reach 1 more time here. I do recommend that you do a couple sets of 12. I mean, that's really a good place to be. So go ahead and relax, go ahead and stop. You're gonna listen to me talk while you finish up your last set here. So go ahead and relax, about 30 seconds of rest or so, and then get after it again. You can tell I'm a little short of breath and labored. It's because it works a lot. We wanna be efficient, and what's more functional than a squat? So you're gonna move into it again, stand up and reach, stand up and reach. Do those 12 times. And then after you finish those 12, just be really happy with your body that you were able to do it and just enjoy the moment, right? We want to take our body and enjoy it for what it has to offer. So if you're working on improving core strength when you have disc bulges, yes, it does take time That little workout was just a snippet of what's required. If you look in the description, I have some more information about core strengthening, but when it comes to it, you want to stay efficient, you want to stay persistent and consistent. So stay after it. It will get better. Team up with a movement professional if you need some help along the way. Disc bulges can get better. The radiating discomfort can get better, but it takes work, time, and effort. So team up with somebody if you need to, but spend the time on your body. It's well worth it. And as always, guys, stay healthy, keep moving, and take care of yourself.